First aid kit. A first aid kit is a collection of medical supplies for providing immediate assistance in emergencies. Must-have items in my first aid kit. 1. Information card. A personal information card in a first aid kit contains the owner's name, emergency, contacts, allergies, medical conditions, and medications for quick reference by first responders. 2. Triangular bandage. The T bandage is a versatile item in a first aid kit used for supporting and securing dressings, especially in areas that require flexibility like joints. It's also helpful for creating slings for arm injuries. 3. Cotton balls. Cotton balls are often included in first aid kits for cleaning wounds, applying antiseptic solutions, or creating padding around injuries before applying bandage. 4. Face mask. A face mask in a first aid kit is used to protect both the responder and the patient from airborne pathogens and contaminants, reducing the risk of infection during emergency situations. 5. Sterile gloves. Sterile gloves in a first aid kit protect against contamination during medical procedures or first aid, safeguarding both the responder and the patient. 6. Gauze band. A gauze pad is commonly used as a dressing to cover and protect wounds, absorb blood or other fluids, and promote healing. 7. Strip bandage. A strip bandage in a first aid kit is used to cover small cuts, scrapes, or wounds, providing protection from dirt and bacteria while allowing the wound to heal. 9. Cotton buds. Cotton buds in a first aid kit are used for applying antiseptics, cleaning wounds, or removing debris from small areas, providing a sterile and precise way to address minor injuries. 9. Thermometer. A thermometer in a first aid kit is used to measure body temperature, helping to assess if someone has a fever, which could indicate an illness or infection. 10. Whistle with flashlight. A whistle with a flashlight in a first aid kit serves a dual purpose. The whistle can be used to attract attention in emergencies, while the flashlight provides illumination, aiding in navigating dark or low light conditions. 11. Medical tape. Medical tape in a first aid kit is used to secure bandages, dressings, or splints in place, providing support and stability to injured areas. 12. Medicine box. Tape in a first aid kit is used to secure bandages, dressings, or splints in place, providing support and stability to injured areas. 13. Gauze bandage. A gauze bandage in a first aid kit is used to securely wrap wounds or injuries, providing pressure to control bleeding, support to injured limbs, and protection to promote healing. 14. Antibiotic ointment. An antibiotic ointment in a first aid kit is used to prevent infection in minor cuts, scrapes, and burns by applying a thin layer to the affected area. 15. Hydrogen peroxide. An antibiotic ointment in a first aid kit is used to prevent infection in minor cuts, scrapes, and burns by applying a thin layer to the affected area. 15. Pain relief liquid. A pain relief liquid in a first aid kit is typically an over-the-counter medication like ibuprofen or acetaminophen, used to alleviate minor aches and pains. 16. Aspirin. It is found in some first aid kits as an over-the-counter medication used to relieve pain, reduce fever, and alleviate inflammation. It's also commonly used as a blood thinner to prevent heart attacks and strokes in some cases. 17. Rubbing alcohol. Alcohol, typically in the form of rubbing alcohol or alcohol wipes, is included in first aid kits for cleaning and disinfecting wounds and surfaces to prevent infection. 19. Betadine. Betadine, found in some first aid kits, is an antiseptic solution used to clean and disinfect wounds, cuts, and abrasions to prevent infection. 20. Scissors. Scissors in a first aid kit are used for cutting bandages, tape, clothing, or other materials, when providing medical assistance or administering first aid. Keep safe, everyone.